Ready? We're going to start. Can everyone hear me?
Yes.
Yes?
Yes.
Okay. All right. Thank you all. Thank you for joining us this evening. Good evening and welcome to the New York City Health and Hospitals Fiscal Year 2022 Annual Public Meeting for the Borough of Manhattan. Good evening, ladies and gentlemen. Before we start the formal program, I would like to call to your attention that we have language translation services for those who need it. And hopefully those who are tuning in to us will benefit from it. Those languages that will be available for translation is Cantonese, Spanish, Mandarin. If you require these services and would like to register, please speak now or call 212-788-3359. That's 212-788-3359. Thank you. I'm Barbara Lowe. I'm the city council representative for Manhattan for the New York City Health and Hospitals for this board of directors. Hi there. Calamai. Calamia. Yes. Can you hear me? I want to thank you all for joining us and would like to introduce the board members who are participating. Jose Pagan is our chair of the board of directors. Robert Nolan, he's our city council representative for Bronx. Hi, Robert. Commissioner Gary Jenkins, Sally Pinero, Freda Wang. Hi, Freda. And Dr. Mitchell Katz to my left. He is our president and CEO. Also on the panel are Andrea Cohen. She's our senior vice president and general counsel. She's our moderator for this event this evening. And next to her is Calicia Hercules, our secretary to the corporation. I would also like to acknowledge Assembly Member Inez Dinkins. Is Inez on board? Hi, Inez. Or maybe her representative, perhaps, okay. She is Assembly Member for the 70th District of New York State Assembly. Assembly Member Rebecca Seawright. She's the 76th District of the New York State Assembly, representative of that particular district. Our district representatives include Marissa Maverich, joining on behalf of Congresswoman Carolyn B. Maloney. Thank you. She is our New York's 12th congressional district for quite some time. Councilwoman Carmen de la Rosa is our New York City Council District Representative, or she is the council, sorry about that, De La Rosa, for District 10. On behalf of the board, I would like to extend our thanks and acknowledge leadership at our Manhattan facilities. We have Georges Recante of Harlem, Christina Contreras from Metropolitan, William Hicks, Bellevue, Floyd Long, Henry J. Carter, Stephen Catulo Kohler, and Dr. Susan Sales Gouverneur. And our doctor, of course, we have our favorite doctor here, CEO. Their dedicated staff is providing exemplary services. We all know it. It's been phenomenal during this time. to our public health system, and the people we serve. And to all of you here, thank you for your support as we strive to provide equal access to safe, affordable, quality care to all. Tricky pages. Now let me turn the microphone over to our President and CEO, Dr. Mitchell Katz, to continue with his remarks. Thank you all.
Thank you, Barbara, for that wonderful introduction. Last year, we marked 2 years since New York City Health and Hospitals admitted our first patient with COVID-19. These 2 years and 4 cycles have been extremely difficult. Our patients have suffered, our families have suffered, and our healers have suffered. Let's take a minute to remember the lives lost, those who continue to suffer from the impact of this pandemic, and honor all of the New York City Health and Hospital heroes who serve New Yorkers at every stage of this pandemic. And we're very proud of what Health and Hospitals has done throughout this, in addition to the excellent care that we've provided to people with COVID at our hospitals, at our clinics, and our nursing homes. We've also provided more than 10.5 million COVID tests at our facilities, and we've distributed over 4 million at-home tests to schools. In January, we administered our first COVID vaccine, and by the end of March, we celebrated our 100,000th vaccine. Since then, we continue to prioritize vaccination for all of our employees and our most vulnerable patients in their homes, having administered more than 1.7 million vaccine doses across the 5 boroughs. We opened 3 COVID-19 centers of excellence in Bushwick, Brooklyn, Tremont, Bronx, and Elmhurst, Queens, to serve patients with long-term symptoms. Through contact tracing, we identified 1.7 million contacts and helped 33,000 people isolate at quarantine hotels and delivered more than 2.2 million free meals to those who were quarantined. In addition, we created several other programs to serve New Yorkers hardest hit by the pandemic, including our street health outreach and wellness units, our COVID treatment outreach to help those at highest risk of developing serious infections, our aftercare program, and our quarantine and isolation guidance tool to help people to keep themselves and their family safe. Overall, I feel strongly that Health and Hospitals did over the last 2 years whatever needed to be done, whatever the city most needed in order to stay safe was the mission of Health and Hospitals. In addition to our COVID work, we did not rest on only COVID. We continued to provide care of the highest kind to all of our patients. We had several new leaders that I wanted to recognize who are in the area of Manhattan, and I'd say they're all 3 great leaders who have also been in other roles in Health and Hospitals. George LeConte, who's our new CEO of Harlem Hospital, Christina Contreras, who is our CEO of Metropolitan Hospital, and Stephen Catullo, who is our CEO of Kohler. Want to mention that all of our hospitals in Manhattan were noted by U.S. News and World Reports as high performing for clinical excellence in at least one specialty area. 2 of our hospitals in Manhattan were recognized for how well they serve people of color in their surrounding communities by the Lown Institute. That was Metropolitan and Harlem, among the most racially inclusive hospitals nationwide. Newsweek named Bellevue one of America's best physical rehabilitation centers. We commemorated the 20th anniversary of 9/11 with community events at Bellevue, where we have our flagship clinic, the World Trade Center Environmental Health Center. We also opened a new same-day surgery unit at Bellevue. We at Metropolitan, through Christina's efforts, announced an innovative partnership with the government of the Dominican Republic to provide healthcare services to employees of the Dominican Republic, one there in New York. Metropolitan received national recognition for a Million Hearts initiative, and that Metropolitan also reached a significant milestone of having performed 100th gender-affirming surgery. So many great things in this amazing hospital system and clinic system, and I couldn't be prouder than I am to be the director. Thank you.
Okay, good evening, everybody. I'm Andrea Cohen. I am the Senior VP and General Counsel. Did I interrupt you, Ms. Lowe? No, okay. For New York City Health and Hospitals, and I will be moderating the balance of tonight's program. For those of you who have just joined, I want to remind you that we have language translation services available in Cantonese, Spanish, and Mandarin. And to access these translation services, please call, and I wish I could say them in the 3 languages, but I can't, 212-788-3359. And the translation services are available if you call that number. We are gathered here tonight virtually one more time, hope maybe the last time, due to COVID-19 public gathering restrictions. But we are here for our public hearing for the Borough of Manhattan. This is the second in a series of 5 meetings that we conduct annually across the city's 5 boroughs. The purpose of the annual meeting is to inform the public on the programs and plans of New York City Health and Hospitals, and you've just heard Dr. Katz speak about those plans. And now we move on to the part of the program where we afford the public an opportunity to present oral testimony and to submit written testimony concerning New York City Health and Hospitals performance. All testimony, whether presented orally tonight or in written form, will be transcribed and forwarded to all the members of the Board of Directors for their consideration, although, as you can see, they are here with us also listening tonight. Anybody who would like to speak, you have until 6:30, 10 more minutes to register if you have not already done so. And to remind you, the number to call if you'd like to register to speak is the same number, 212-788-3359. At 6:30, we'll close the list for members. At this point, I just want to highlight a couple of the rules for the road for those of you who will be speaking going forward, and I'll try to move quickly. The most important thing to understand is that this is not a Q&A forum. From this point on, the goal of our board members are to listen to you, members of the public, and some elected officials to talk about New York City Health and Hospitals and not to engage in a dialogue. So we will just be listening. In order for each registered speaker to have an opportunity to testify, we've allotted 5 minutes of speaking time to each speaker. On your screen, when you're speaking, you'll see an electronic timer that will provide a guide about the expiration of your time. The light will be green when you begin speaking. A yellow light will indicate that you have 2 minutes remaining, and a red light will signal that your time has elapsed. A few seconds after that, it will start to blink, and I will interrupt you if you have not yet been able to conclude your remarks and ask you to do so as quickly as possible. If you aren't able to complete your comments in the time that you have, please don't worry. You can submit anything in writing this evening or tomorrow, and can learn how to submit that by calling 212-788-3359, that same number. Your entire testimony in that case will be sent to our board of directors. I will do my very best to pronounce names correctly. If I make an error, please forgive me, number one, and number two, please correct it for the record so that we know how to pronounce your name. Thank you so much for being here this evening, and we will now hear from the first presenter. I would like to ask Council Member Carlina Rivera, the District 2 Chair of the Committee on Criminal Justice, to go first.
Hello, everyone. Good evening. I am Carlina Rivera. I am so grateful for you all allowing me the opportunity to speak here with you briefly. I will not take 5 minutes. I'm Carlina Rivera again. I represent District 2. That's home to Bellevue Hospital, where I was born, very close neighbor to Gouverneur Hospital as well. And last term, I served as chair of the City Council Committee on Hospitals. And I know how involved H&H is in also providing correctional health services to those detained and incarcerated. And I want to take this opportunity to thank Dr. Katz and the entire team at New York City Health and Hospitals, especially our heroes, doctors, nurses, and staff system-wide who worked relentlessly on the front lines of the pandemic and continue to show up every day to keep New Yorkers healthy and safe. I also want to thank the Community Advisory Board, all the countless volunteers. I myself served on the Community Advisory Board of Bellevue Hospital many years ago, and it was an absolute privilege where we discussed things that included patient advocacy and how to, improve the services existing in the facilities. So without all of you, there is no health in hospitals. We are immensely grateful for your service and sacrifice. I know some of us got to know each other very well over the pandemic, to see the needs of our system. We always knew that this system was needy. It serves our indigent care pool. These are facilities that open their doors to everyone. And it is just a system that is well known throughout the country as providing world-class care. So in the council, and you'll hear from my colleague, Councilmember Gail Brewer, very, very soon, we'll be fighting for funding, whether that's through capital infrastructure needs, whether it's machines, facades, upgrading certain departments. We're going to make sure that we're advocating for those dollars. We do not need to see the downsizing of any of these facilities. They are very, very important. As we saw, many communities are underserved across the 5 boroughs, and H&H does what it can with the resources that it has. So we gather here this evening to hear from New Yorkers regarding the performances of our hospitals. And I commend H&H for creating these spaces to reflect on current practices and then affect change. So of course, we also welcome and look forward to hearing stories of success, congratulations, or thanks. I always tell people I take complaints, but I always take compliments, and I'm sure we all feel like that every once in a while. So you're not here to really hear from me, so I will wrap this up. But please know that I have been at Health and Hospitals very, very recently to visit family, to get my booster, my flu shot, for testing and tracing purposes. So I want you to know that you have an ally in City Hall. There are a number of us who will fight to make sure that we're improving services and retaining what we have. And if you need anything from me, you can always reach me at district2@council.nyc.gov or 212-677-1077. Thanks again, everyone, for the time.
Thank you so much for your comments. We appreciate them. The next speaker is Council Member Gail Brewer from the 6th District, or District 6, who is also chair of the Oversight and Investigations Committee. Councilmember Brewer.
Thank you very much. I think you can hear me. I can't tell with WebEx.
Yes.
First of all, I too want to thank, as Council Member Carlina Rivera did, Dr. Katz, the doctors, the nurses, the staff, the cabs. I'm a big fan of also Laura Atlas and Chelsea Cipriano. Those individuals not always working for H&H, also for the Department of Health, but they have kept us going the entire pandemic, 7 days a week. In fact, I'm in the district office And Chelsea's parents came in, and uncle came in today, and we're all very proud of her. So I just want to let you know, she's at DOH, but she represents H&H also. So anyway, a couple of things. First of all, just so you know how much we appreciate it, we've been giving out the home test kits, which they come from Mayor Adams, but they really come from you or from health department, from H&H and the health department. Just yesterday, we gave out 1,000. And I just want to thank you because actually right now in 2.5, 2.4, and 2.3, they're the highest in terms of persons contracting COVID. So the fact that you are our backers in terms of getting information and support to people, I appreciate it so much. We're all, as Carlina Rivera stated, focused on funding, and I think the federal funding is incredibly important. You need more of it. Certainly Senator Schumer has been pushing for that, but we know that the health department is starting to see corner testing sites either close or start to charge, and we need the federal government to do their part. Now, just like Carlina Rivera, I do not go to those corner sites to get anything, but others do. I go to you or I go to sites that I feel are more part of our healthcare system. But we do need to make sure that we have the $10 billion of the funding that Schumer is fighting for. And I also want to just mention the city budget process, as you heard earlier. I'm a big fan of health and hospitals, and I want to see, I noticed that in the mayor's preliminary budget, there is funding for New York City Care and 100 million mental health service corps at 12 million, and correctional health stays the same at 277 million. I think there are lots of issues, maybe not your fault, but the issue of trying to get individuals who need the health care from Rikers to your amazing staff continues to be a problem. What we didn't see was more money for Be Heard. What we didn't see was enough money just generally for COVID. So in the city council, we are adding money for Be Heard, which I know brings mental health professionals and the police to try to respond to mental health crises without just the police making that call, which is incredibly important, mental health. And I think we also are trying to find more money for all the COVID issues. I just want to mention a couple other things, because as we are fighting for more money for the federal government, we have to, what's going to happen with 3K and what's going to happen with some of the other programs that are not going to be funded by the federal government in the future. Big issue. I want to mention just a couple other things that are of interest to me. As Dr. Katz mentioned, you have wonderful leaders at your hospitals in Manhattan. And at Metropolitan, we still need $65 million for the emergency room to be renovated. And I hope, obviously, I now represent the west side of Manhattan, but I'm very big mouth, and I will still keep fighting for things that are of concern. Secondly, 60 Madison is sitting empty. It used to have Gouverneur there, but now Hamilton Madison should take it over, and it would be a fabulous center for them that also would include healthcare. I also want to thank Dr. Katz, because we spent a lot of time at Kohler with many challenges during the pandemic, and Health and Hospitals was very responsive. I'm a big fan of Philip Cook, who works at Harlem Hospital. I just want to give you his name because he really is the wonderful individuals come and go who run the hospital, but Philip Cook is always there. Sign up for our newsletter if you haven't already, because it's fabulous. And I want to echo my colleague, Councilmember Carlina Rivera, and say how important you are to our city. And please let us know ways in which we can be helpful to the Health and Hospitals Corporation. Thank you very much.
Thank you.
Thank you very much, Councilmember. Our next speaker is William Smith. He is the chair of the Metropolitan CAB.
Good evening, everyone, and thank you so much for the opportunity. I'd like to thank New York City Health and Hospitals and its board of directors for your strong support of Metropolitan Hospital, being the community hospital of choice for residents of East Harlem and Upper East Side who rely on our services. I would like to acknowledge our esteemed Chief Executive Officer, Ms. Cristina Contreras, for her unwavering and continued commitment to our hospital in her work to not only bring the staff together, to be supportive of our community advisory board and the broader community, but also know that our community has a strong, dedicated partner in leadership at our hospital. Metropolitan is a true community hospital. We have generations of patients and families who have come to rely on Metropolitan for their health care. This is especially clear during the last 2 years of the COVID-19 pandemic. Our friends and neighbors looked upon Metropolitan for testing, for vaccination, for information, and for care. And we're proud of our healthcare heroes. Diabetes is a major health issue in our community. We're proud that the hospital has been recognized as a Diabetes Center of Excellence by the American Association of Diabetes Educators and as a Diabetes and Patient-Centered Medical Home by the National Committee for Quality Assurance. Programs like a CDC designated, National Diabetes Prevention Program, nutrition counseling, and weight management, including surgery. Metropolitan continues to work towards engaging staff in meaningful ways, providing opportunities for sharing information on best practices, and creating employee recognition programs that make staff feel valued and appreciated for the dedication that they put forward every day, keeping our patients and our community healthy and safe. Metropolitan's ongoing commitment to meeting the needs of our community involves the active participation of our Community Advisory Board in its mission to address the needs of our community as they arise. As chair, I'm grateful for this opportunity to serve and work towards advocating on behalf of our community in conjunction with our elected officials on the local, state, and federal level, in our collective effort to ensure that not only Metropolitan continues to meet the needs of our community, but is better prepared for future challenges. So it's such a pleasure for me to serve in this capacity and support the Community Advisory Board, as well as the staff and the great staff of Metropolitan. It's through our collective efforts that we will be able to succeed as a hospital and as a broader community. Metropolitan has been a real beacon for our community, especially the past couple of years. Our hospital needs sustained capital investment, as Councilmember Brewer highlighted, in order to expand these wonderful services. We need funding to upgrade and modernize the aging infrastructure of our hospital that has been in place since the 1950s. The team at Metropolitan does an amazing job ensuring that our patients not only receive quality care, but receive the information they need to go about their lives in a prosperous way. I thank everyone for their unwavering commitment to our community. East Harlem thanks Health and Hospitals for Metropolitan, and we're immensely thankful to the Metropolitan staff for all of the work that they do. And our Community Advisory Board very much looks forward to working not only with our other CABs, but as well as with the administration of the entire system. Thank you.
Great. Thank you so much for your comments. Our next speaker is Karen Dixon, who is the chair of the Harlem Hospital Community Advisory Board.
Good evening, everyone. My name is Karen Dixon, and I am the chairperson of New York City Health and Hospitals Harlem Community Advisory Board. It is my sincere pleasure to formally thank and acknowledge our New York City Health and Hospitals President and CEO, Dr. Mitchell Katz, and the Board of Directors for New York City Health and Hospital. The year 2021 was indeed one of great challenges and transitions for New York City Health and Hospitals Harlem. We said farewell to our wonderful CEO, welcomed an interim CEO, and searched for our current CEO. We also dealt with a pandemic, vaccine rollout for different age groups, booster shot, a system failures issue, and Legionella in the community. Nonetheless, together we made it, and we are stronger as a result. It is my great honor to thank our former CEO, Ms. Ebony Carrington, for her distinguished service to the village of Harlem, always keeping us informed about the hospital's conditions, especially during the COVID-19 pandemic. It was also my pleasure to work with interim CEO, Dr. Eric Way, and to have served on the selection committee for our current CEO, Mr. George LeConte. We started 2022 with George LeConte at the hospital's helm, and we are still thrilled to begin this journey to greatness with him. A bit of a year in review. Harlem did a tremendous work to improve and emphasize in-service staff education, update signage guidelines on COVID-19, provide PPE training and COVID PPE cards. The Infection Prevention and Control Department maintained 24/7 interdisciplinary collaborations, which allowed them to implement and streamline the updated guidelines with frontline and support staff to ensure a safe environment for staff and patients. Temperature screenings occurred at every entrance with minimum impact on wait times. Clinics had great patient engagements that included 20% face-to-face visits as well as 80% televisits. The ambulatory surgery unit was open as volume of emergent surgeries ramped up. Harlem participated in several COVID-19 clinical trials, hosted virtual COVID-19 update dialogues with community-based organizations and senior centers. The hospital currently has an ample supply of PPE and supplies. During the 2021 calendar year, Harlem administered 6,523 influenza vaccines. During this same period of calendar year 22, they administered more than 54,000 COVID vaccines, Additionally, in May, the first COVID vaccine for adolescents aged 12 and older was administered at Harlem Hospital. In July, we unveiled our community mural in our pediatrics department. And if you ever get a chance to visit, it's a beautiful mural. In August, we participated in Harlem Week and Hope for Harlem, two great events with significant contact with the community. In October, we began our COVID-19 vaccine third dose program. And in November, we began to distribute pediatric Pfizer doses for children 5 to 11 years old. In December, and on December 2nd of 2021, New York City Health and Hospitals Quality Academy held its first session. This 6-month-long training is taught over 8 half-day in-person sessions. The Quality Academy is a voluntary training program that gives clinical and non-clinical staff the knowledge, skills, and tools to lead performance improvement projects in their units and work settings. Finally, in December, our hospital police hosted a staff safety awareness discussion in collaboration with the 32nd Precinct Crime Prevention Unit and Community Affairs Officer Unit. Our hospital community also mourned with FDNY the loss of 31-year-old probationary firefighter Vincent Malveaux, who passed away after a training exercise. The community continues to be impacted by a variety of health issues, including hypertension, smoking, diabetes, lung disease, such as asthma and tuberculosis, alcohol and drug use, obesity, HIV and sexually transmitted infections, cardiovascular disease, stroke, mental illness, psychiatric disorders, cancer, and still the fear of Legionnaire's disease. But more importantly, our CAB continues to believe in providing service to the community and working with the Harlem Hospital staff and leadership to ensure that the best services are delivered to the Harlem community. Thank you, and I look forward to our ongoing work together.
Thank you.
Thank you so much for your comments. Our next speaker is Isabel Ching, who is the president of the Gouverneur Community Advisory Board.
Thank you. Good evening, and I'd like to first congratulate the re-nomination and confirmation of Dr. Michael Katz. So thank you again for being our president and CEO of Health and Hospital, and welcome all of our distinguished guests. And thank you, Gail, for the shout out. Yes, 60 Madison is something that we are looking and interested in providing more mental health in our community. My name is Isabel Ching. I am the chair of Gouverneur Community Advisory Board and a local community leader where I serve as the executive director of Hamilton Madison House, which is located in Lower East Side in Chinatown, a few blocks from Gouverneur Hospital. So it is my pleasure to welcome everyone to Gouverneur Annual Public Meeting. Gotham Health Gouverneur provides exceptional quality and high value care to our patients. Gouverneur has demonstrated an ability to adapt to the changes in healthcare throughout its existence to meet the healthcare needs of its community. This public meeting is important as it demonstrates our commitment to collaborate with community partners, healthcare neighbors, colleagues, government officials, and other stakeholders. And with the leadership of Dr. Morris Gagliardi, the Gouverneur Gotham ambulatory sites provides over 200 visits annually and became vaccination and testing site throughout the pandemic. Demand for testing increased during the surges, in particular the Omicron surge, when the site tested 600 plus per day. The cumulative doses for COVID vaccine was over 27,000 as of mid-March of 2022. With the leadership of our Susan Sales, our CEO, Gouverneur Skilled Nursing Facility has 295 beds and 95 beds providing subacute rehabilitation and 200 traditional long-term care beds. Throughout the last year, the Skilled Nursing Facility has continued to serve its long-term residents and keep them connected with their families and has returned over 600 patients to the community following rehabilitation. While the healthcare landscape is experiencing tremendous change and challenges, Gouverneur continues to move forward to fulfill its mandate to ensure that all New Yorkers have access to high-quality healthcare, regardless of ability to pay or immigration status. Gouverneur is also a member of the Gotham Health and Hospitals, a federally qualified health center, and FQHC is a federally designation given to a safety net providers that meet high quality of care guidelines for the services provided to underserved populations. Being part of the Gotham Health FQHC enables Gotham to better fulfill its mission and remain fiscally viable. I am very proud of our role in meeting the healthcare needs of New York's most vulnerable populations and ensuring that everyone has access to high quality care. Gouverneur's ability to deliver healthcare services is based upon a tradition of working with its community partners and to provide high quality care to all New Yorkers. These successes could not have been possible without the support of the Gouverneur Community Advisory Board. On behalf of Gouverneur's senior leadership, I extend my heartfelt gratitude to the Gotham Health leadership and the Gouverneur CAB community partners and for your support to given to Gouverneur. Thank you.
Thank you.
Thank you very much for your comments. Our next speaker is Everett Person, the chair of the Sydenham Community Advisory Board.
Good evening. Can you hear me?
Yes, thank you.
Yes. Good evening. I'm Everett Person, the chair of the Sydenham Community Advisory Board. And on behalf of the board, I want to congratulate Dr. Mitchell Katz on his reappointment as president of the New York City Health Plus Hospitals. However, we are not surprised since our board has had an amiable relationship with Dr. Katz's team, Senior Vice President Dr. Ted Long, and Gotham Chief Executive Officer Michelle Lewis. Both have encouraged open communication and discussions have focused on how we can improve our centers and improve the health of our community. Currently, our 118th Street facility is bursting at the seams in terms of inadequate space and the massive utilization of our services. In conjunction with our board and the management of Gotham, there is a potential location which appears to meet our needs, and we look forward to hearing further information about that site. As a longtime native Harlemite, I have noticed over the years the closing of several hospitals and clinics in and around our catchment area. All the data suggests that Harlem has medical and clinical needs that require additional resources and attention, like hypertension, diabetes, nutritional services, and etc. Often, it appears to me that we have more fast food chains and liquor stores opening rather than ambulatory clinics. And of course, it shouldn't be that way. So there is a way of addressing this. One, comprehensive planning for new clinics with the involvement of the community and stakeholders, nonprofits. And two, marketing our Gotham facilities so that the community is aware of who and what is Gotham and the services these centers provide. I recently viewed on TV one of our Gotham facilities, which showed the architectural beauty of the structure, as well as informing the viewing audience of its existence and services. At that time, we were talking about NYC Cares. Clearly, this public service announcement can pay dividends and should be used for all our Gotham sites. The name Gotham must be recognized like any public or private medical center in NYC for its excellence. There is no need for a community resident to travel outside their community to receive primary care services. Individuals will use any facility if they are clean, safe, and provide the medical services. And Gotham is moving in that right direction. The Sydenham Board has been in Central Harlem since the 1970s, serving and making a difference in our community. This particular area, which from 118th Street going west to on borders of Columbia University down to Fifth Avenue and 112th Street, has somewhat changed economically and with a significant amount of diversity. However, the medical needs remain the same. This is a challenge for our board, Gotham Health Plus hospitals. As we move further into the 21st century, we must become clinically creative, providing the state-of-the-art equipment for our clinics and identifying new strategies for meeting the needs of local and diverse community. We have the know-how and skills, but we just must act. ACT. Thank you.
Thank you so very much. Appreciate your comments. The next speaker is Donna Veronica Gill, Vice Chair of the Sydenham Community Advisory Board, I believe.
Yes, good evening.
Yes.
Can you hear me? Thank you. Thank you very
Yes,
much.
yes, we can.
Dr. Katz and the Health and Hospitals Board. My name is Donna Veronica Gill. I'm the Vice Chair of the Sydenham CAB, and I wanted to speak to you today about Sydenham. The facility has, we've administered COVID vaccine, 13,000. So we are part of that 100,000 vaccines that Dr. Katz spoke about. Sydenham was the first site in Central Harlem to start vaccination and testing. And I was very proud of that. And Dr. Katz and Gotham Health assisted with us being the first, and I was able to tell all of the residents that I spoke to in the community about Sydenham. Sydenham is in the middle of a block, so we actually need more, as Mr. Person said, more advertisements so that people know that we're there. We're quality healthcare. We have clinics at Dyckman in the NYCHA houses, and we have clinic at St. Nicholas. So we've had these clinics for a while in these public housing facilities. I think we may need to maybe think about having some more, because the residents in public housing are very happy to just go downstairs to the clinic and get services. Traveling becomes an issue for some of our residents or our clients, because some of them are elderly and they can't really do a lot of traveling. So I wanted to emphasize the fact that we were first in COVID testing. We had tents outside the clinic and COVID vaccination. Now we've gone to Health and Hospitals Go vans, which is stationed outside the clinic. It moves up and down the block. There's always activity going on there. And I'm very proud of that. And thank you for allowing us to do that. Additionally, Ms. Dixon at Harlem spoke about murals, and actually we were part of the community arts in medicine mural painting, and we had 3 murals, one at Sydenham, one at Dykeman, and one at St. Nicholas. The Sydenham mural is especially especially great because we had icons from the old Sydenham Hospital public and citizens activities in order to not get that facility closed. So the mural has Dr. Reverend Diane Lacey, who was the former H&H vice chair and acting chair, Dr. Ibun Adeola, and Judy Wessler was also there, and we had the unveiling of that particular mural, and it's beautiful. And I invite everyone to come to Sydenham, to all of our clinics, to see the beautiful murals. I was involved in helping to paint some of those murals because it was a community activity, and I think that helped in putting our clinic on the map. Gotham Health, we do have issues as far as space, as Mr. Person says, and we're working on that. But with the space that we do have, we are doing a lot of service. We have a mammogram facility, which was great. Councilperson Gail Brewer was very helpful in assisting us to get a van for our facilities so we can go from one to the other, which is actually great. And we still have to have a celebration to thank her for that. And we are now in the process of trying to find a space or to get citizens to our sites to understand the value of a medical facility within their community that can assist them with the issues that are in our community: diabetes, asthma, nutrition, and we are also an FQHC facility. So that has helped us in order to maintain our sites and get more people to come in. We always
Thank you. Would you mind, would you please, can you
to
just
get new
conclude your
patients.
remarks?
Sorry.
And if there's anything more
Thank
that you
you.
want to add, you can certainly send it in writing.
Yes,
You
I
you
will.
can conclude. Okay.
Okay. So basically all I wanted to say was that Sydenham is a
Thank
great
you.
place. Health and Hospitals has helped us, and Gotham Health is actually on board with a lot of things that we're interested in. Thank you very much.
Thank you very much for your comments. Our next speaker is Cleveland Manley, president of the West 118th Street Cultural Association and a member of the Sydenham Community Advisory Board.
Yes, good evening, everybody. Thank you for allowing me
Good evening.
to speak, and thank you for all the speakers that spoke before me. And thank you for allowing me to come here and speak today. I feel very proud, and because I'm a Harlemite. I grew up in Harlem when the bad days, and I see how Harlem changed. And I'm also a cab member of Sydenham, and it was an honor in the early part of the pandemic that we survived the staff of Sydenham and saluted them with the 28 precinct and our local fire department, and we survived them with a caravan coming and share with them what they do for the community and for the patient. It was an honor to be part of that. And we had signs up in the windows and on the fence, and I still have my sign up with a heart in my window for them. They do so much in the community. I live right across the street. I look out the window every day and see what's going on with Sydenham. And it's an honor to have that Sydenham clinic right there, because I saw it when it was a methadone clinic, and now it's a health clinic. And we have a senior citizen building right on 118th Street on Frederick Douglass Boulevard, YT Walker Senior Center. And I can see the seniors walk there to the clinic. don't have to travel too much. They can walk right there to the clinic. So it's very helpful that our clinic is there and doing so much. And also, I'm proud to be a member of the CAB because being a man, to know about healthcare, to share that with the men of the community. I have personal friends do not like to go to doctors. They don't go to doctors. And I could get this information that I learned from signing, being on the board, and watching, talking to y'all tonight, that give this information back to men that don't like to go to doctors, and being a part of that, like that. And I do a lot of things in the community. I'm a county committee member. I'm a member of Canaan Baptist Church, 28 Precinct Community Council, and I be in the field out there sharing the information, the health information to our community to get involved, come and get your help, especially men. We need that. So it's proud to be a member of the CAB, the Sydenham CAB, and it's proud to sit here and listen to you all speak and make me more proud of being a part of it. And I'm learning so much to get to my community. And I thank each one of y'all. And also the last thing I'm gonna say, if no one tell you to love you, dear God love you, and so do I. And thank you for allowing me to share a few minutes with you. Thank you. Good night.
Thank you very much for your comments. The next speaker is Anthony Feliciano. He's the director of the Commission on the Public Health System. Hi, Anthony. Are you with us? Okay. Move to the next speaker and see if Anthony is on after that. The next speaker is Scott Wohl, Senior Manager for Community and Government Affairs for the Live On New York organization. Scott Wohl. Okay. Then I will mention that Ronnie White from the Bellevue Community Advisory Board, correct, did submit written remarks, and that will be shared with our board for their review. If there are no other speakers signed up, I think we will just conclude for the evening. Thank you so much for attending and for sharing your thoughts about New York City Health and Hospitals, and have a safe and good evening.
Thank you.
Thank you, everybody.
Thank you.
Good night.
Night.
Good night.
Night, Sally.
Night, Barbara. Night, Chair.
Bye, Sally and Frida. Bye-bye.
Bye-bye.
Bye.
Thanks, everyone.